impact of nursing. So my question for you is, nurses play a very central role in the healthcare profession worldwide in just providing care, but also it is influencing our economy. So I would like to address your thoughts that in your opinion, how does investing impact the economy in our nursing profession? Kindly brief the audience.
Good morning everyone, and thank you for the question. It's a wonderful question. So I would like to say that investing in nursing education and nursing workforce can basically give a lot of financial and societal benefits. First, it will reduce the cost of the readmission and the hospitalization of the patients, because when we have qualified and skilled nurses who are working in the clinical settings and in community areas, they basically provide the kind of treatment and education to the patient and their families, in which they know exactly what kind of protocols need to be followed. If we don't have a quality nursing profession and nurses, then what will happen that the quality of treatment will hamper, and because of that the cost will increase. Second, it will also increase the efficiency of the hospital administration and all the resources that we are using in the hospital settings, because they know exactly how to provide better interventions to increase the faster recoveries and usage of number of beds promptly and prompt discharges of the patients. If they are not getting those responses from the nursing staff and healthcare staff, that what would happen that there will be a lot of delay. Patient will have to wait for the treatment, the quality of treatment will not be that good, and because of that the cost will increase on the patient aspect and the resources aspect of the hospital administration. And there are nursing professionals who are nurse practitioners. They can provide treatment and interventions to the patients at a very cheap cost as compared to the doctors. They can perform a lot of procedures, both surgical and medical, in which the cost will be quite low and the patient won't have to go to the doctor again and again for any kind of treatment. Now we can also talk about the kind of nursing education, because it is very important that we focus on building the future of nursing profession. So if we are building the next generation of nurses, then it becomes very critical that we invest in nursing education, where it comes from school level, where we are giving education to the students that why do they need to enter in nursing profession. It can be about the remuneration or the benefits of income, the quality of salaries that they will get if they get into nursing profession. It is also about the respect that they will get. There is also another aspect of nursing profession that you can become a teacher, a professor, you can get into research work. So when you talk about investment in terms of economy that nursing profession is providing, it is the largest employment in the world when it comes to providing jobs and providing healthcare services to the people in the world. And especially for women, it is increasing that gender equality. If we talk about that, there are very few number of professions in which women are doing much better than men. Healthcare, nursing and midwifery and teaching, these are the only handful professions where women outnumber men. So that is why it becomes very critical that the government and the private sector focuses on investing in nursing profession and nursing education, because everything starts from the groundwork. So if we are focusing on the groundwork where we are building talented, skilled and passionate nurses who are hardworking, who know what skills they have and who know that they take care about patients, then in that scenario I think the economy of the nation will also go. There are some data that I would like to discuss with you. There have been research done by International Council of Nurses. According to that, the poor health outcomes reduce global GDP by 15%, and investing in nursing could potentially boost global GDP by $12 trillion or 8%. That is a substantial substantial amount. And also, WHO reports that inadequate quality of treatment given to the patient by the nurses cost $1.4 to $1.6 trillion each year in lost productivity in low and middle income nations. So, developing countries like India or Africa, over here there is a lot of money going to waste because of the quality. And as we all know that in times of pandemic like COVID-19, as we have observed during the lockdown, majority of industries were shut. They were not operating. But healthcare industry was on the front line fighting the pandemic and providing healthcare services to the patients and the families. So even during hard times, either it's war going on or a pandemic is going on, the services and healthcare services to the people. So that is what I would like to say. And according to the World Bank, in some countries, the potential earning aims for women who have 3+ year degree, like bachelor's in nursing, have a possibility of earning more than 300%. There is no other profession on the planet that can give you this much increase in earning potentiality. And in the end, I would just like to say that as the president of International Council of Nurses, Dr. Pamela, she said, and I quote, "What is important now is to make sure that we reinforce to the world that nurses no longer want to be hidden. So it's time to take a stand and it's time to improve the services of our nursing profession."
Okay. Mr. Palash, as a panelist, you were given a choice. So my part is, are you trying to say that economy is overpowering nursing profession, or nurses are getting care at an underpaid extent?
So this is the later one. Definitely they are being underpaid, and the government and the private sector both can do much better when it comes to investment. So the latest data which I was looking at, India as a nation, we only invest or spends 3% of our GDP on healthcare, and it covers the entire healthcare investment, not only nursing. So this is
Which is challenges faced by nurses. So my question to you is, nurses face numerous challenges every day. I hope you agree. From physical demands to emotional burden to burnouts, they are having a lot of issues. Like, most significant challenges are being faced by nurses today. What steps you will take to address them today?
The national health of this country, it is very important for us to understand the challenges that are faced by nurses on a daily basis. So as a nursing student, soon to be part of the work sector and the incredible workforce of nurses, I believe that it is essential that we talk openly about the struggles, the pressures and the systemic issues that the nurse faces. So regarding this question, I will be dealing with it in 3 phases, 3 segments. The challenges that can inherit in the nursing profession, the impact of nurses during the time of the COVID pandemic, and the the understaffing and lack of resources that are prevalent in today's society and in the nursing profession. Now on to the challenges. One of the major challenges that nursing profession faces, as ma'am told us, is the burnout and the exhaustion. Now, nursing profession is a noble profession, but it is also a quite demanding one. Nurses often face extreme burnouts due to long working hours, irregular shifts, and increased patient loads. In hospital, nurses work 12-hour shifts without adequate breaks. Adding to that, the emotional labor on a daily basis, the nurses witness suffering, terminal illnesses, and some even witness death. We are there for the families at the worst moments, but that emotional burden that we have doesn't go at the end of our shifts. It carries on, and over time it builds to have impact on the state of our emotional, our physical aspects, and as well as our mental aspects. So I Having burnout can lead to low performances, health, morale, and decision-making. The another one would be poor work-life balance. Now, maintaining work-life balance, as in maintaining a balance between the personal and the professional life, is a huge challenge for nurses. Because nurses, as we know, work for long shifts, night duties, and sometimes they work for overtime as well, frequent overtime, which makes it difficult for them to spend quality time with their family, attend important functions, peer gatherings. So what happens with that is, when you are unable to attend these kind of social gatherings, it will affect their mental status, it will affect their social relationships, and it will also take a toll on their personal happiness. Another one that I can remember now is lack of resources, lack of recognition and career advancement. Lack of recognition, the nurses are generally undervalued. The nurses also have a problem with upward mobility in India. That's the reason that majority of nurses look to go abroad for opportunities. So little to no respect is given, sometimes leading for us to frustration and the poor performances. Going on to the next segment, I would like to shed some light on the impact of COVID-19 pandemic on the nurses. Now, COVID-19 pandemic was an unprecedented time for all of us, I'm sure, but especially for the nurses, they were at the center of it all. So, one of the major impacts in COVID-19 was the unprecedented physical strain that it took on the nurses. They were compelled to work double or triple shifts, and there was increased demands for nurses during the time, and there were extraordinary physical strain on the nurses. And there were no breaks given. They used to wear PPE kits, as we know, personal protective equipment, for as high as 12 hours. So obviously you can understand, if you wear PPE kits for 12 hours, it can take a very bad toll on your physical health. And at the same time, as I am speaking this, I remember there was a viral photo that was going on, the eye patch that you wear, the scars, and the photos that really signified the physical strain that it took on the nurses during that time. So these kind of strains, sometimes they exhaust people, and one thing I remember as well is people see their colleagues affected by the exhaustion, but you still have to be there on the other day. The next day you have to be there no matter what. So, and some people who didn't have their personal relatives with them, the last rites were also done by the nurses as well. Another one would be the mental and the emotional strain that it took. So imagine being surrounded by fear, loss, and uncertainty every day. And the thought that you could potentially bring virus to your loved ones and to your homes. It can add to your anxiety, depression, and nurses also felt PTSD during those times. And these kind of things can leave an emotional impact on the person, and it can also take psychological toll on the nurses, and it can leave emotional scars on the nurses. With that being said, I remember an example that a while back ago I was doing my clinical duties in Metro Hospital, where I met a nurse, and while talking to that person, I understood that they were part of the times of COVID. They were working there, and I got to know that unfortunately they got diagnosed with COVID as well. So by discussing with them, I understood that they were made to be isolated, and they were separated from their family for about 90 days. So you can understand, they had a little daughter, she needed to be taken care of, but you can understand she was a mother. So you can understand the physical toll and the psychological toll, more importantly, that can take on the person. Imagine being not able to talk to your daughter, or not able to see your daughter for 90 days. And these were some of the mental or the emotional strain.
Mental as well as physical, which I feel is going to be not justified.
I'll focus on strategies to improve nursing retention, role of technology, and also importance of nursing leadership and advocacy, and how these together will create a stronger, better environment for nurses. So first of all, one of the most pressing challenges in the nursing profession as of today is nursing retention. That is, nurses are leaving their jobs or even the profession altogether because of any kind of challenges they face in their profession. It could actually lead to a shortage of nurses, stress of the remaining staff, as well as lower quality of care for the patients. It also puts a financial burden on the hospitals as they have to spend extra money and resources to find, hire and train someone new. So we need strong practical strategies to improve nursing retention, especially in India. While fair and competitive packages are essential, we need evidence-based strategies as they can go a long way. I'd like to share a few practical as well as effective solutions. First, we need to establish strong mentorship and preceptorship programs. What happens often is that new nurses feel overwhelmed because of their transition from a student to a professional. So we need mentorship programs like those implemented in AIMS Delhi and CMC Vellore, where the junior nurses are paired with more experienced ones, so that, like Mr. Bibin mentioned, reduces burnout and also builds clinical confidence. Second, we need supportive and safe working environment. Nursing retention is linked with the emotional and physical safety of the nurses. So we need protection from workplace violence, bullying, and even understaffing. INC also suggests that safe staffing and OPA regulations can go a long way in improving nursing retention. Third, we also need recognition and respect for the nursing role. When nurses have When nurses have a say in patient care policies, they feel more valued and engaged. We need flexible scheduling and work-life balance also. Study published that Indian Journal of Occupational Health published a study which revealed rigid schedules and night shifts often contribute to high attrition. So we need flexible scheduling. We need predictable patterns that help balance personal life with work, especially for the female nurses who also manage family responsibilities on the back. We also need mental health and emotional support programs. Like we know, nursing is emotional taxing. It takes an emotional toll on the person's personal as well as professional life. So we need institutions that offer mental health counseling, peer support groups, as they contribute to high retention. Psychological check-ins are also essential as they improve job satisfaction as well as retention rates. The last but not the least, career growth and development is very essential, as many nurses are leaving their jobs because they feel stuck with no room to grow. So we need promotion to higher levels, leadership training, mentorship training, in-house workshops to improve and build nurses' confidence. Second, I would like to talk about the role of technology in improving nursing profession. In the evolving landscape of healthcare, technology plays an essential role in enhancing the scope and efficiency of nurses. It serves as a catalyst for precision, accuracy, streamlined workflows, and often also delivers best patient care for nurses. And we also have a transformative advancement which has been implemented, which is electronic health records. It serves as a digital platform which facilitates real-time access to patient histories and well as reduces documentation error, which improves both patient outcomes and operational efficiencies. We also need technological tools such as smart infusion pumps, barcode medications, administrative systems, which not only minimize human error but also elevate medication safety protocols. We also need remote technological methods like wearable devices, blood pressure cuffs, blood glucose monitor devices, and we enhance the nursing role by allowing continuous surveillance of vital parameters from a distance, which is very essential in intensive care settings as well as home health services, where the early detection of early complications can be life-saving. We also, moreover, the integration of advanced simulation, virtual reality, and e-learning also provides nursing with dynamic as well as immersive training experiences. For example, I can think of an example in which Manipal College of Nursing has high-fidelity stimulator mannequins, which have the physiological functions of a human. So the nurses can practice any kind of procedures in an emergency as well as maternal health situations in a risk-free environment. Also, structured integrated technological advancements empower nurses to focus more on holistic patient care and less on administrative burden. The third topic that I would like to discuss is solutions to improve leadership and advocacy. So, we all know nursing leadership is
Sorry for the
like
interruption, Ms. Devi. I wanted to add the point that you used Manipal. I hope you are aware that over here we have two more simulation centers. One is HTT Gurgaon and the other one is TNM. You can discuss.
So, we need programs which assist the leaders in leadership. We need to teach them how to communicate well with the team. We need to teach them how to work together with the team properly. We need mentorship and coaching. The most new emerging leaders should be paired with the most experienced ones so that they can build confidence and skills together. We need to encourage advanced education. We need to promote higher education for deeper knowledge. As a person with a good knowledge skill in the backside can also improve a lot to the healthcare system. We also need to recognize and reward leadership. We need to implement recognition programs that value leadership efforts and also advocacy success. We also need to encourage speaking up culture. So I think the problems are only going to be solved when we speak about those problems, when we speak about it and we choose to find solutions to those problems. We need to promote a safe environment where the nurses feel confident to reach out and to address their problems without the fear of retaliation. Leadership and advocacy aren't just positions or roles, they are responsibilities. When nurses are supported by strong leaders who fight for their well-being and professional growth, the entire healthcare system benefits. To sum up my topic, improving nursing profession, we need to implement nursing retention strategies. We need to implement the role of technology in a better way. We need to understand the importance of nursing leadership and advocacy to create a better and safer environment for the nurses.
I have spoken about challenges, situations, solutions, about opportunities, about economy. Now we would like to discuss about future of nursing, where we are dwelling, in which stream we are dwelling, and how can we prepare our student nurses to meet those challenges in the future. Over to you.
Good morning, everybody. Thank you, ma'am, for that wonderful question. It is an absolute honor to be a part of this vital discussion. I would like to answer that question in three parts. Firstly, I would like to discuss about the emerging trends in nursing education. One of the major trends that we have seen is advanced simulation-based learning. Nursing education is increasingly incorporating high-fidelity simulation centers, which provides the students with a more realistic clinical experience. An example of that would be Goodwin University, which is in East Hartford in the US. They have a $3 million simulation center with interactive mannequins. And they can replicate medical conditions really well, and it gives the students a more hands-on learning experience. An example of that in India would also be, like ma'am said, DNA and SGT Gurgaon. The second emerging trend that I noticed is integration of AI in nursing. AI, it helps personalize nursing education as well as care for the patients. Its applications, it includes virtual nursing assistants as well as AI-driven patient monitoring systems. Another trend that we've seen, perhaps the most beneficial and important to us as future nurses, are an increasing focus on nurse mental health as well as their well-being. The nurse burnout, we are trying to address nurse burnout more nowadays. We're trying to promote and improve the mental health of nurses. There are programs that are being implemented which provides mental health support to the nurses. We'll be providing stress management resources as well as we're trying to foster a more supportive environment for the nurses. We've also seen a growing emphasis on cultural competency as well as diversity, because obviously in a hospital we meet different kinds of populations, and we must train our students, our nurses, in accordance with this diverse population. So teaching them about cultural diversity is about the most important. The second topic that I would like to shed some light on is need for innovations when it comes to nursing education. The first primary reason is evolving healthcare needs. The complexity of modern healthcare, which includes chronic pandemics, the current state of nurses' mental health, as well as chronic diseases. All of these things, we need our nurses to have up-to-date knowledge about these things, and we need our nurses to have critical thinking skills. Innovations, they bridge the gap between traditional learning and current clinical demands. So it is absolutely important. The next point is technological advancements that are taking place. Healthcare is becoming more and more technical. The next reason is student engagement. Obviously, traditional lectures are perhaps not that suitable for our tech-savvy students. So innovative methods like gamification, virtual realities, like I mentioned, simulation centers, they really help our students in understanding the topics really well, and it makes education more accessible as well as engaging. So they're able to understand the topic and the concept really well. Clinical skill development, clinical placements, they are extremely competitive nowadays. So high fidelity simulation labs, it allows the students to practice their skills in a more safe and controlled environment. The third topic, which is also very important, is promoting diversity and inclusion in nursing workforce. First of all, why do we have to promote diversity and inclusion in nursing workforce? We need to do that so that we can improve the patient care. Patients, as like I said, they come from different kinds of populations. They follow different cultures. They belong to different populations. They come from different areas. So we need culturally competent nurses so that they can provide better care and treatment to the patients. Language and cultural understanding, they also decrease the miscommunications that may take place and they improve health outcomes. We also need this for improving our team performance, because as when we have a diversity and we're trying to solve a problem, put our heads together and we try to solve that problem, each person will have a unique perspective. They have their own opinion, which will lead to more innovative decision making as well as problem solving. Now that I've discussed about the need for innovations, I would like to also speak about the strategies framework. The strategies that we need to employ to promote diversity and inclusion in nursing workforce is, first of all, the most important one is education and training. We must educate our nurses to become more culturally competent so we can provide better treatment to our patients, and also train. Inclusive leadership trainings are also very important, and bias awareness. We must also have inclusive policies such as zero tolerance policies for discrimination, and we must also promote fair treatment. There should also be, and the leadership roles. We should also see a diversity when it comes to leaders, because like I said, when we see a diverse population, they will bring their own opinion and they'll be able to speak up for their own communities. We must also recruit people from underrepresented groups so that they also have the voice, they also play a role in this amazing profession that we're in, and they also play a role in our leadership roles. I hope I have just given justice to your question, and I hope that as future nurses, we are the future of nursing. We have the power to change things, and I hope that the information that I've shared today plays an important role in all of our lives. Thank you so much.
Future of nursing is bright, as we are aware, but yet it is challenging because the profession we are in is poised to play a pivotal role in nurturing and transforming global healthcare. As you have spoken about AI, so what your perspective was that in the future only AI will be needed, or we as nurses will be having our job in the sector or the field?
AI will definitely play a very important role in the future of nursing, but that does not mean that AI can replace us in any ways, because AI can do a lot of things. It will be extremely helpful when it comes to managing things, especially monitoring the patients, and like I mentioned, HR. But we need nurses to manage the AI. AI cannot replicate sympathy. They cannot maintain idea with the patients. We need actual humans with actual emotions.
Yeah, I agree with that, because each exec, they have to be empathetic, which definitely. Thank you for panelists, Mr. Palash, Mr. Bibin, Ms. Angel, and Ms. Aleena, for sharing your views on different topics, which was economy, challenges, solutions, and lastly, future of nursing. Now the floor is open for the audience. If anybody have any doubts, the floor is open. You all can please ask the panelists. With any of the panelists, if you feel free to interact with, you can question. Is there any question from the audience side, or we can wind up the session? Any of the dignitaries